So I'm by the name of Innocent Karachezi, and I'm a student at Southern Hampshire University, pursuing healthcare management. I want us to point on some topics. So in this video, and the first one, I want us to look about the status of how is the status of healthcare quality look like in developing country settings. So according to Orbis by Science, it says that 1 billion people live in developing countries on less than $1 per day, and actually 2.5 billions are living on actually less than $2. So more than 2.6 billion people lack access to toilets and other sanitation facilities, whereby 30,000 children under 5 years of age die every day, mainly from hydration, undernourishment, and preventable diseases. Also, low and middle income countries bears 90% of world diseases, but composed only by 12% of world's health expenditures. So to continue, there is not only actually correlation between poverty and lack of accessible healthcare, but also causation. Poverty can lead to death of available healthcare, and also ill health can create what I can call as a cause of poverty. So in many developing nations, lack of knowledge contributes to the health care shortage, of course, and in such case, members of the community do not have the education to stop preventable diseases, and medical practitioners do not have that knowledge to treat diseases after people become ill. So when medical practitioners in developing nations are well educated and effective in their field, they often migrate to wealth countries where the wages and working environment are better for them, to favor them to work. Of course, this is very easy to understand because we actually, as people, normally we actually move for money. So if you have knowledge and skills, but you found the salary that you are receiving at the moment is what I can say that is not for you. You feel like it's not enough, and you maybe you are finding another offer from another given country, which is going to pay you, of course, much money than that you are being paid there. So in that case, you will move where you will be having more money. So that's why some of the educated people, they move where they will find more money, and the working environment is in their favor. So the second point I want us to look on is different risks that the patients are experiencing due to the lack of quality of care, of course. So we know that today we are in the world where many diseases are coming out, and in some cases, most of the healthcare practitioners or the people who are providing health care facilities to the patients, they are not aware. So in that case, of course, the patients will get some risks from such instance. So like today, we are having some of the risks where the patients are being affected, like inaccurate diagnosis. There is what you call medical error. There is what you call unnecessary treatment. There is inadequate or unsafe clinical facilities or providers who lack adequate trainings and actually expertise prevail in all countries. So I would also add what I can call death. Also, the death is other risks, because there is some patients who are receiving, the overdose, they are experiencing the things of overdose or less dose, and those people actually are likely to die. So according to World Health Organization, the situation is worst in low and middle income countries, where 10% of hospitalized patients can expect to actually acquire an infection during their stay, as compared to 7% in high-income countries. So around 15% of hospital expenditure in high-income countries is due to mistaken care or patients being infected while at the hospital. For instance, because the patients are using the toilets, of course, from healthcare facilities. So those toilets mainly used to bring the infection to the patients as well. So the other point that I want us to actually to talk about is what we call the priority areas that need such emphasis in terms of quality improvement. To start for this, I think there is a lot of areas that need some much emphasis in terms of quality improvement. Coordination, of course, safe management can be there, literacy, health literacy care across cutting areas in which improvements would actually benefit a broad array of patients. So I would say also the 17 that follow is, I would say that there is also improvement in communication, of course, around the healthcare facilities. That is where I think that it's an area where the improvement should be there. So also reflecting on the risks that patients are being actually facing, there should be also improvement in surgical care, like when they are making operation to patients, that should be improved, because it has found that most of the people in underdeveloped countries, they used to have consequences after they are being carried out operation, after the surgical care that they have been received from the hospitals. So from there, they used to bear what I can call the consequences of that. So also the things of end of life also should, I think, on myself, it should be actually improved. Of course, there are the people who are suffering from the diseases, and those people are not going to. This is not going to be cured, and so the person bear such kind of bad situation. So, and he's maybe suffering, and he's not going back to normal stage. So in that case, the things of end of life care also should be improved as well. So also the care to children, adolescents should be improved for them to be educated about themselves, and of course they get the knowledge of keeping or going well with their stages of age, if I can say that, because children's of course they used to eat everything what they used, and so therefore the care should be improved for them. So the last point that I want us to actually talk about, let's see about the different interventions that stakeholders of healthcare industry should take into consideration for remediations. So basically we know that patients, physician, employees, insurance companies, pharmaceutical firms, if I can say, and government are the stakeholders that should intervene in the healthcare industry and take into consideration for remediation, of course. So the first one, I would say that stakeholders should have value, value should be given to stakeholders. It is always actually sorry. It is always better to actually to emphasize, if I can say, the stakeholders, like asking for advice. For instance, a physician can ask a patient a very helpful question, like how can we best serve you? So I think, and therefore the answer is forward looking, and guess what, of course. So from there, you have a real chance to know what is better to do for the patients to deliver a quality health for them. So the other thing that I can say is communication, of course. So ongoing communication presents the strategy to actually secure and maintain stakeholder support, and actually intervene them in and maybe use for remediation. So I said this because if you maintain communication with stakeholders, so the programs that you are actually want to put into place is going to be happen, of course. So the collaboration we should be take into places. So for instance, you know that government is stakeholder in healthcare, of course. So you know the money, most of the money to put into actually healthcare, they are provided by the government. So the second one is what I can say, law enforcement, of course. So the government is the one to put the law for just regulating all of the facilities that healthcare facilities want to give out to the patients. So that collaboration should be made, and the intervention, decision makings, and looking what better to do and what to not do. So for those institutions to actually come up with a better decision and improving the quality of the health. Thank you for watching. As I said, by the name of Innocent Karichezi. Thank you.